Diabetes. Public health professionals would declare it's an epidemic if the condition where an infectious illness spread from person to person, even if there are inherited risks factors that you can have no control over. There are still many things you can do to avoid adding your name to this concerning disease. Here's 17 proven habits that can help to keep diabetes away from you. Number 1. Drinking coffee. Love coffee? Then hear this. According to a 2012 study in the Journal of Agriculture and Food Chemistry, those who consume a lot of coffee, at least 4 cups a day, have a 50% decreased risk of acquiring type 2 diabetes. That's because coffee includes substances that block HAIAPP, a molecule that causes type 2 diabetes to start. It was also discovered in a study that people who increased their regular coffee intake by 1 cup had an 11% lower risk of acquiring type 2 diabetes. Number 2. Say no to sweetened beverages. Due to the increased rates of childhood obesity, diabetes is now increasingly prevalent and it affects an increasing number of youths and adults. Switching to healthier beverages like water from sugary ones like soda is a simple strategy to prevent diabetes. Each sweetened beverage a person drank elevated their risk of type 2 diabetes by 20%, according to a 2016 study by Swedish researchers that was published in the European Journal of Endocrinology. Number 3. Drinking alcohol in moderation. How does that work? A recent study says you can lower your chance of developing diabetes without giving up alcohol. Don't believe that? Then see this 2005 meta-analysis that was published in the journal BMJ Open Diabetes Research and Care. The analysis revealed that persons who drank alcohol in moderation had a 30% lower risk of type 2 diabetes. Up to 1 drink per day for women and up to 2 for males. Improves the effectiveness of insulin in bringing glucose into cells. Number 4. Limit your portion sizes. Limiting your intake, or at least being aware of it, is a simple strategy to prevent diabetes without actively restricting your diet. In a 2-year study of pre-diabetic individuals published in the Journal of Diabetes Research and Clinical Practice in 2014, it was discovered that those who reduced their portion sizes in addition to restricting their intake of carbs and oils had a 46% lower risk of developing diabetes than those who made no lifestyle changes at all. Number 5. Eat blueberries regularly. Fruits like blueberries, grapes and apples are a great approach to prevent diabetes. In a 2013 analysis of data from 3 studies involving more than 187,000 participants, researchers at the Harvard School of Public Health discovered that participants who consumed at least 2 servings of these fruits per week reduced their risk of type 2 diabetes by as much as 23%. Number 6. Eating breakfast at time. Are you someone who skips breakfast running a busy schedule? Well then, you're likely to develop diabetes. A meta-analysis of 6 studies indicated that skipping breakfast is just once per week was linked to a 6% higher chance of developing diabetes. You may be able to reduce the risk of type 2 diabetes by making breakfast a daily habit. A 55% increased incidence of diabetes was observed in subjects who skipped breakfast for 4 to 5 days per week. Number 7. Sleep enough. When determining how much sleep is ideal for your health, 7 hours is the magic number. According to a meta-analysis from 2015 that was published in BMJ Open Diabetes Research and Care, every additional hour of sleep was linked to a 14% higher chance of developing diabetes. Conversely, those who slept for less than 7 hours also had a higher chance of getting the condition. Number 8. Take a cycle for a short journey. If you want to earn some health while travelling as an add-on, consider a bicycle. It might be exhausting and make you appear a little messy on hot summer days, but studies are saying it may reduce your chances for diabetes too. A Danish study that was published in PLOS Medicine found that those who commuted to work by bicycle had decreased risks of type 2 diabetes, despite the fact the fight against diabetes can be greatly aided by merely taking up cycling as a pastime. Number 9. A balanced diet with more veggies. Achieving and maintaining a healthy weight depends on establishing good habits. It's critical to follow a balanced diet that includes foods from different dietary categories. If you want to reduce your risk of diabetes, cut back on your meat intake. In 2019, a team of researchers from Harvard School of Public Health examined 9 studies that looked at the relationship between dietary habits and diabetes risk. They discovered that meat eating was not as good as eating a plant-based diet, which was linked to a 23% decreased risk. Number 10. Stress management. Your physical health, as well as your mental and emotional well-being and your chance of developing diabetes are significantly impacted by how you manage your stress. A 2018 study that was presented by an American Heart Association Scientific Sessions conference examined data from over 22,000 women over a 3-year period and discovered that those with the highest levels of stress had an almost double risk of developing diabetes. So less stress, lower chance for diabetes. Number 11. Work out. A 2019 study found that moderate muscle mass lowered patients' risk of type 2 diabetes by 32%, notably in terms of preventing diabetes. You can't support your body's capacity to utilize insulin and absorb glucose more efficiently by frequently engaging in physical activity and working out your muscles harder. Your insulin produces cells that aren't as taxed as a result. Blood sugar levels can be better controlled by interspersing extended periods of inactivity, such as computer use, so every 30 minutes spend a few minutes standing up, moving around, or encouraging in some light exercises. Number 12. Limit mouthwash use. Although a nightly mouthwash swig may be beneficial for gums, the rest of your body won't benefit from it. According to a study in the journal Nitric Oxide, among 1,200 overweight people from 40 to 65, those who used mouthwash at least twice a day had a 55% higher chance of developing pre-diabetes and diabetes than those who used it less frequently. The study also found that mouthwash contains antimicrobial components that influence nitric oxide production, which can result in metabolic diseases like diabetes. Number 13. Hang out with friends. Seeking a justification to spend more time with friends and family? You should be really happy about that as well. For men, living alone was linked to an 84% higher risk of diabetes, according to research published in BMC Public Health in 2017. Number 14. Alternate day fasting. If you're concerned about getting diabetes, try to finish all of your food earlier in the day. Researchers from the University of Alabama at Birmingham discovered that individuals who had improved blood sugar control when their meals were consumed within a 6-hour window that started at 8:30 and concluded before 3 p.m. Number 15. Lowering your blood pressure. Just a decrease in your blood pressure can prevent type 2 diabetes and maintain the health of your heart in one fell swoop. How does diabetes relate to your blood pressure? When your heart has to work harder, you are more likely to develop diabetes and heart disease. If your blood pressure is too high, it can be controlled naturally. Discuss taking medication with your doctor. Number 16. Reduce media consumption. The risk of developing diabetes has long been raised by sedentary behaviour. Thus, it should come as no surprise that cutting back on your daily TV viewing is one strategy to prevent the condition. Researchers found that watching TV for an hour increases your risk of acquiring diabetes by 3.4%. Number 17. Visit the doctor regularly. Seeing your doctor frequently is one of the greatest methods to prevent diabetes and treat it for when you have it. Your lifestyle can be shaped with the aid of health risk assessments, which also support the prevention of chronic diseases like diabetes and other lifestyle-related illness. Even though diabetes is a pandemic in and of itself, managing your nutrition and routinely completing health risk assessments can help you stay informed about your health. Try to adopt a healthy lifestyle with these 17 habits and say no to diabetes. You are never too late to get started.